we can keep it pretty informal. But I guess if you maybe can just go ahead and introduce yourself, like education and all that.
So first of all, thank you to all the students for tuning in. My name is Kate Cohen. I am originally from Boston, Massachusetts, and I went to New York City for college. I went to Barnard College. I was sort of seeking a career in the performing arts, which obviously didn't happen. I found my way into medicine through some interesting research and coursework I did in college, and decided to stay in Manhattan for medical school. I graduated from Mount Sinai in 2011. And due to some unbelievable mentorship that I had while I was a student, I chose the field of anesthesia. I matched in Boston. I did my internship at Leahy Clinic, which is in the suburbs. And then I did my anesthesia residency at Brigham and Women's. And after completing my anesthesia residency there, I went on to do a cardiothoracic fellowship in anesthesia, also at the Brigham. That the Brigham and Women's is one of the Harvard hospitals. Ultimately, when I finished, I took a staff position at the other Harvard hospital, Mass General, and that's where I'm staff currently.
Who would you say were your mentors while you were a medical student?
So Michael Cotero, who's a pediatric anesthesiologist, Ram Roth, who is also an anesthesiologist, and Bridget Flynn, who was an intensivist at Mount Sinai, went to Columbia, and now practices in Kansas.
Okay.
Also,
yeah.
of course, generally speaking, that was in the field of anesthesia. Also, I would have to say two people who just stand out as unbelievable role models for me in medical school. Obviously, David Muller, who's a dean of students, and also Yasmin Mia. I was very involved in EHOP as a student, and she made a big impact on my life and my career.
How did you decide on anesthesia?
So great question. I really enjoyed medical school, and when I thought about my future career, I didn't really want to pigeonhole myself into thinking about one organ system for the rest of my 30 years of practicing medicine. I used to feel that there would be somebody giving a lecture about the heart and say the heart's the most important organ in the body. And then the neurologist would come and say, really, it's actually the brain. But really, what is a heart without a brain? And what is the blood without kidneys? And the whole body's interconnected. And one of the things that really drew me about anesthesia is that you're doing many jobs, touching on many subspecialties all at once. You're at once an intensivist, a cardiologist, a pulmonologist, a hematologist, you're a phlebotomist, you're a nurse, you're a doctor. And it's all at a very fast pace. It's ICU medicine, but faster. And the perioperative period of medicine is really fascinating. It's fast in the area of research and development. And the way that you meet patients is very interesting. I also feel that I connect with patients much more than would be by a lay person be understood, that how much an anesthesiologist interacts with their patients. A lot of time to talk with them, counsel them, discuss anxieties, hear about their lives. It's pretty special.
I like that point that you're a lot of different roles kind of wrapped in one. And then how were you thinking about anything else or any particular rotations that you felt were useful for anesthesia?
So in terms of everything at Mount Sinai was useful. Everything. I would say initially I actually came into med school thinking I'd be a pediatrician. And I only found anesthesia sort of late in my third year rotations. But everything you learn about medicine is applicable to physiology, hemodynamics, development of the human body. Pediatrics is just as important as, internal medicine for the application of perioperative medicine. I particularly, as a standout was the radiology rotation. Believe it was actually an elective I did as a fourth year. I review CT scans and MRIs really frequently before somebody has surgery, just to understand where surgeons might be removing tumors, where there might be risk of blood loss. Does the mass in the neck really deviate the trachea? How might the surgical approach really impact the patient in general? I do a lot of reviewing of radiology, which, I actually think that I think about the things I was taught as a fourth year, like almost on a daily basis.
Yeah, I think the radiology rotation is really important across a number of subspecialties. Like for me, for instance, I would definitely say you would do musculoskeletal radiology. And it's interesting for anesthesia. I guess I never thought that radiology would be a critical component, but I can see why, especially for cardiac, why it would be.
Oh, sure.
Yeah.
But also, there's also more than just cardiac anesthesia. I mean, we practice medicine as well. And people come with a lot of interesting complaints, and you have to be able to interpret an MRI of the spine in a basic way, and other imaging to really define people's pain and pathology of their pain as well.
And then how did you decide on cardiac anesthesia?
That's an interesting question. I took the advice of my program director when I said I wanted to stay in Boston post-residency. And he said, listen, the job market's tough, get a fellowship. Interestingly, it's what I did. It's a really fascinating practice of anesthesia. There's an unbelievable teamwork like there exists nowhere else in operating rooms, I believe, because the anesthesiologist is working directly with the surgeon, showing them the TEE pictures and using your communication slides, and maybe even diagnosing something that was unknown before surgery that would change the operation completely. Then the perfusionist is communicating with you, the anesthesiologist, for drug management and anticoagulation. And there was an unbelievable team dynamic that I felt was really interesting. And so that's probably what led me to the fellowship, also just to get an edge on the job market.
Did you have to change duties during the pandemic or when it was in Boston?
So still in Boston.
We're still in Boston?
I know, unfortunately. I didn't actually, nobody in the Department of Anesthesia at Mass General was redeployed to a different job. Many of us worked more in the ICU than we did in the operating room. Mm-hmm. I stayed mostly in the operating room. I don't know whether that was better or worse. There were still a lot of people who incidentally had COVID and also had surgical needs. There's been we have collectively as a department had lots of exposure. I don't think anybody has actually become sick by taking care of patients. We have appropriate amount of PPE and very good protocols at this point. I would say, in middle of March and early April, those protocols were changing by the hour. Really, I think people in the hospital, in our department, have become sick due to sort of issues or social interactions on the outside, in the outside world, or there have been a couple of cases of people eating lunch too close together. Mm-hmm. Certainly, it's a little anxiety provoking, of course, instrumenting the airway of somebody with COVID. Yeah, and I would say hasn't been that exciting for me to be on the sort of the receiving end or the instrumenting end of all of that. It's not really what I imagined my job to be. But I do believe that I'm safe, and that, the no cough extubation has become the thing we all strive for even more than we ever have before. Yeah.
I think similar to here. Some anesthesiologists were redeployed, but some of them were still continue to cover the OR. So I think I want to keep this relatively informal. So I think if any students, if you want to just take yourself off mute, introduce yourself, what year you are, whether or not you're applying for residency or just exploring. So I'm sure other people have questions. So if you guys want to start, that's fine. If no one has questions, then I'm just going to keep asking. So.
Hi, I'm Drew. I'm an MS3. It's a pleasure to meet you. Um, I'll actually, I'm actually going to be doing my anesthesiology clerkship in about a week, so this is pretty interesting.
Great.
What kinds of things did you do on your, I guess, on your anesthesia clerkship that you felt were, that really helped you kind of get a good feel for the specialty, outside of like maybe like the basic day-to-day tasks like pre-op rounding and that sort of thing.
Oh, sure. Um, so I really just jumped in. I had a mentor who really wanted to include me, and this is Bridget Flynn, who's unfortunately no longer at Mount Sinai, but she would start me. I watched my first anesthetic on the first day. In the second anesthetic, I put the IV in the asleep patient, so I could just get a feel for what the procedure was like. And then in the third anesthetic, I did it on an awake patient. So I had this sort of scaled kind of graduated learning and building of confidence with every procedure I did. Um, I would say, the best thing to do is sort of watch the dance the first time. And then maybe, I know that there's an amazing simulation lab, uh, and you should try to go there. Try an intubation on the mannequin. Try to get a feel for what the procedure is. And then after that, try it on your next patient. I would say, trying to do the interview by yourself in sort of in a way that's supervised would be very informative for you. Taking a history, documenting everything, doing an airway exam, and then listen as your attending does the counseling and goes through the consent form with the patient.
Yeah, there's a lot of things to learn, like basically every step of the way. How do they get access to the lab?
Do you know, there used to be, there's a chief resident every year, and there's somebody who, at least when I was a third year med student, would always allow us to go in. So there has to be a chief resident who could let the students in to be able to practice.
Okay.
And I think it's very commendable if you go to your attending sort of the day of and say, listen, it's really important for me to learn an intubation. It's really important for me to learn how to do an IV. I'd like to practice on a mannequin. They'll help them. I guarantee. Yeah. I mean, if somebody came to me and said that, I would know exactly what to do for them in our hospital system.
Does anybody on the call right now know if they're going to apply for anesthesia?
Hi, I'm Taylor. Actually, I had a question. So I'm a fourth year. I just applied last week. So I'm really excited, very excited. But I was in that vein, I was wondering how it is that you decided on Brigham and Women's and kind of what you looked for in an anesthesia program, and obviously being on the other end, kind of what makes for a good one.
Absolutely. So being from Boston, I had the idea that I wanted to come back to live a little bit closer to my immediate family. And so that was the geographic pull for me. And the interview day was really it. Now it's going to be harder for you because you're going to be interviewing in a pandemic. So I imagine everything will be remote. But it's so critical for you to get a chance to talk to some of the residents sort of offline. The single most important thing I can stress about a residency is that you pick one that you feel comfortable in. You need to have a comfortable learning environment and a place that fosters intellectual curiosity. Unlike the time in school where sometimes you can feel, like you can either be right or you can be wrong, residency should be totally about how to get into interesting conversations. The practice of anesthesia is not right or wrong. There's many ways to practice. And there's a breadth of practice. And even within an institution you train at, there will be people who practice differently. So getting into interesting discussions, picking people's brain, doing theoretical cases in your head, or, obviously the ones that actually come your way. That is going to be the most important thing about your residency. So I think you should go where your gut tells you, these are people I'd like to talk to. These are people who feel accepting and welcoming. And I also can't stress that, even with the best residency, it's definitely hard. I mean, even though their work hour regulations, an 80-hour work week is really tough. It takes its toll. And I think it's nice to be able to go somewhere where you have social support. I understand not everyone can do that or has the opportunity to, but I'll say living near my parents and some friends really made a big difference for me while I was training. So sort of another thing to sort of keep on the back burner as a backup.
Yes.
What's a typical schedule like for you?
So right now as staff, I wake up at 5:30 and I'm in the ORs by 7. So I live in the suburbs. It takes me about half an hour to drive in and then get changed. I start in the ORs at 7 and sometime around 5-ish, I'll sign out. But it's all dependent on what's happening in the ORs, if there's relief, if there's not relief, and how sick the patient is I'm taking care of.
And then you also cover the ICU, you said too?
I don't.
Or, oh, okay.
We did during COVID times.
Oh, okay.
I mean, everywhere was an ICU in COVID.
Yeah.
Like we had patients on the anesthesia vents, we had patients on travel vents, and they were units set up everywhere in our recovery rooms. And so we wound up staffing the ones where they used a lot of anesthesia and OR equipment.
Okay.
So one other nice thing about anesthesia is I work part-time. So I'm a 75% commitment instead of 100% commitment. 2 days of every work week, I'm home with my kids. And it does offer a really nice work-life balance in that sense. One thing that a student might consider when picking the field of anesthesia is that forever you will take overnight call. There's no way to practice anesthesia without being in the hospital overnight at some point. And those calls, whether you're in an academic practice or a private practice, they never go away. And there's sort of a difference between taking phone calls in the middle of the night as an internist, and being able to answer a couple of phone calls versus being awake and massively transfusing a patient. There's just like a whole different stress level and a whole different exhaustion that comes after a night of working in the operating rooms.
How many nights a week or how many nights a month do you have to take call?
2 nights a month. It takes me about a week to recover from each one.
Mm-hmm.
So until I feel like myself again. And so that's, about half of the month. I feel a little bit lagged from call lagged, so to speak.
Yeah.
Hi, Dr. Cohen. Thanks so much for your time. I'm Thomas. I'm a first-year student. And just to speak a little bit more about the work-life balance, and also like the general support and the mentorship that you received at Sinai. I can't speak on behalf of the entire school or class, but I feel like a lot of us are exhibiting or experiencing some sort of Zoom fatigue or lecture fatigue in that sense. So what would you say your primary outlets during the first and like all throughout Mount Sinai were? Like, were they more aligned with the hospital itself, like EHOP you mentioned, or were they more outside of this whole Mount Sinai bubble just to get a breath of fresh air?
Yeah, that's a great question. So I worked at EHOP, I think all 4 years, I signed up as a clinician, but also I sat on the steering committee some years and did clinic manager 1 year, which was really cool. And I also worked with MSMI, which I hope is still there. They run international trips. I hope it's still there.
I'm not sure.
Oh, darn it. Too bad. I actually took 2 trips to Honduras first with a medical group and second with a surgical group, which were incredibly informative outlets. And then, I guess outside of Mount Sinai, in the non-pandemic history, I did things. I really enjoyed New York City. I would go and usher at the Joyce Theater, which is a small dance theater downtown. They give you a free ticket if you passed out pamphlets. So I used to do that. And my grandmother used to live in Manhattan, just a mile from Mount Sinai. So I used to visit her a lot as well. My heart goes out to all of you. I think it must be very hard to be a student online without your classmates. It's got to be very challenging. I don't have the best solution for you right now, except, wait it out and try to get some sense of normalcy with seeing people outdoors in a safe setting.
Yeah, I think they're actually, they started the first years not remotely, not on campus, but now they're starting to phase them in very slowly over the next couple months. But yeah, like, can you imagine doing anatomy, remotely?
No, I can't.
And so what do you feel like your career goals are now, now that you started practice? And
So I'm 5 years into my practice at this point, or I guess I'm just starting my 5th year in, and I have been working towards collaborations with academic groups and also industry in the area of innovation. That's sort of just where my interests have taken me recently. I'm interested by the fact that, we all practice medicine in the most advanced country in the world, it feels like sometimes, but yet there's still major gaps, and there are holes in where patients need things and we don't have things to help them. So I'm sort of fascinated about the area of early development of drugs and early development of devices. And I am making a small pivot. I'm never going to leave clinical medicine, but I am making a small pivot to join up with a couple of different teams to be doing some of this early development innovation work.
oh, yeah, I think that's also the nice thing about anesthesia is you can be relatively flexible with your schedule, but also it translates to a lot of other, not necessarily like traditional medical careers.
Exactly. When Boston Scientific was recruiting for a program that I'm interested in, they wanted a cardiologist. And I said, well, listen, I'm a cardiac anesthesiologist. I also understand hemodynamics and can do all the vascular access, and I take care of patients in a highly dynamic situation. So let's talk. And they said, yeah, let's do this. So there's a lot of application of the skill set and the knowledge base that you get after being an anesthesiologist.
Yeah, definitely. No,
yes.
Go ahead. Yeah.
No, my computer just turned off, but there were a whole bunch of questions that were sent to me previously.
Yes, from Jason.
About residency interviews. Is it anybody interested in that? Especially the 4th years.
I know I wouldn't mind, but I'm not sure about the other folks on the call.
Yeah. So eventually everybody's going to be interviewing for residency, most likely. So I would say one of the most interesting things I was asked during my interview day was not a medical question, but was, if you had an unlimited budget for one day, what would you do with it and why? It was like a psychological kind of interview question, and it prompted a really interesting discussion. And I held on to it. And I then asked all of my interviewers subsequently the same question. People are so interesting in what they choose. Frequently, I asked people if they had an unlimited budget to apply to their department. What would they do with it? Oftentimes elucidated some gaps or some things that they wished they had.
What's the most telling response you think that you got, or offbeat?
Gosh, people say all sorts of things. They say, I'd get a private jet and I'd fly my family to some remote island and we'd just sip pina coladas. To people who are unlimited budget, I'd buy the NRA. Everyone's got a price, and then I'd shut them down. People answer all sorts of interesting questions, all interesting ways, depending on sort of where their internal motivation comes from. And I think it's important not to lose sight of the fact that, you are all interesting people outside of medicine. You are incredibly accomplished. And coming from Sinai, you're going to be well prepared for basically everything that comes at you. The bar is set high for you as students. And so I think a lot of the interview process is trying to find out who you are as a person. So
That's a good cerebral question. I remember I got two of them. One was, how much can you bench press? And then the second one was, if you were a tool in the operating room, which tool would you be? Very stereotypical orthopedic questions. So I might have to cop that one for when I do interviews.
yeah, you should. But what tool would you be?
I don't think I think that might be one that we've asked people. It's
Everyone-
ranged from like, something that does very delicate things to like, hammer, that sort of stuff. So,
Bone wax that goes on.
oh, that's a good one, actually.
Prevent
What
the
did you answer? What did you answer for your unlimited budget?
You know what? I actually tend to think that the best things in life are free. I'd say no to the money. And I was in Boston when I was asked the question. I hadn't seen my family in a long time, and I said, "So how with it? We take a hike, and then go to the beach for a bonfire afterwards." I just wanted to be surrounded by my nearest and dearest.
That's a good answer.
But and then I thought about it since then, and I wonder if I had another chance to answer it. I'd say- And every time I buy a lottery ticket, I wonder the same thing.
Yeah.
I know that I may have answered this or prompted this ever so slightly, but there was a question on what's the biggest lesson I learned from residency. And I think if I were to do it all over again, choose anesthesia and be a resident again, I'd be a little bit less afraid to be wrong, especially in discussions or cerebral exercises, because I think a lot of the value of being a resident is being able to have like a discourse with people who are more seasoned and more experienced than you are. There's only so much you can get from a textbook, and there's only so much you can learn online. And the human mentorship is so much of what your training is. And for every moment you're silent, standing next to somebody who has 20 years of experience, it's a wasted opportunity. So I would just encourage all of you, for when you are a student, when you're a resident, to just ask some questions.
Yeah, I definitely think, unfortunately, it is lost over Zoom and on lectures and books and stuff, but watching the patient interaction, especially when you're around like someone who's really has a good bedside manner, that's invaluable. I would say that's probably some of the most important things I learned through my training was, how do you talk to a patient who is grumpy, or, that like stuff that you're not going to read about it. And so if you can see like a really good physician finesse that's invaluable. So yes, I agree. Ask questions, and just you learn a lot from observing too. So
Absolutely.
Anybody else want to ask questions, or do you want to have Dr. Cohen just kind of go through the list?
I actually have a question.
Hi.
Hi, thank you so much for your talk today. And my name is Dawi. I'm a second-year med student here at Sinai, and I know I want to do anesthesia. And
Awesome.
you briefly touched upon this in your med school experience here at Sinai. You were involved in some global health work. So I wanted to ask you, like while in med school and beyond med school into residency and even as an attending, what are some ways that an anesthesiologist can be involved in the global health scene? Yeah.
I'm so glad you asked, because these were some of the most important experiences I had. I sought out an internal medicine internship that I knew would allow me to, with a pacemaker group that they went, and there's a high incidence of third degree heart block rather, in Bolivia because of the incidence of Chagas disease. A lot of patients need pacemakers. So actually sought out that internship, sort of with the understanding that I'd go with the group in the month that they went. And it was really eye-opening. And then I went on to be a resident, and I spent a month in Rwanda, in Kigali, there's I found a Canadian group that sends residents there every month. And I would say, hey, I'm not Canadian, but you want me to go. So I convinced them to send me. And it was, perioperative services worldwide are in such need. There are so many things that are still yet to be worked out in low resource settings. There's education, there's fundraising, there's interesting techniques that you'll have to use with equipment that has limited capabilities. There's a lot of creativity to be done and to get a safe anesthetic accomplished with really limited resources. They were very safe opportunities and really eye-opening. I, for one, never complain about lack of resources now, even if I hear some people complaining, I'll never join in because there's no possibility that there's anything to complain about. You could be getting anesthesia in Rwanda. And it was also very meaningful for me to meet the residents there and to get to talk to them and learn from them and also share ideas and knowledge with them. But there are like unlimited opportunities. I plan to do it again. I have really little kids right now, a 1-year-old and a 3-year-old. So we're just not ready to cross time zones yet. We just started sleeping again. So I'm just, I hope that in a couple of years, I'll just go with my whole family for some time. And I think there are parents that are braver than I who will take their little kids with them. Everything's possible when you have the will.
Thank you.
But the world needs people like you.
Just out of curiosity, did you use a particular website to look for the Boston Scientific job, or?
So there's an innovation fellowship at Mass General Brigham, which is open to staff, where the either the pharmaceutical, there's lots of opportunities. You could do venture, work with a pharmaceutical company, biotech. You could get trained in global regulatory affairs. And what they do is they take the staff for some part of their clinical time and reimburse the hospital for whatever productivity is lost.
Okay.
And so that's something that was sort of already existed at my institution that I found out about and applied for.
It's a great opportunity.
It's really cool. The learning never stops.
Yeah.
What you stop being a student, it's not the end of opportunities and the end of learning. There's always the next leaf. There's always a next chapter, and everybody recreates their career 5 or 6 times over. And I'm just looking for sort of my next thing.
Yeah. That's a pretty cool program. Is it? I guess probably not that many places have it, or.
I don't actually know how many places have it. What I can do is I can send you sort of the link to it. And then maybe you could see if Sinai could set up something similar. Yeah.
And I think also we have a lot of students who are also interested in like non-traditional careers. Yeah. So that one though is specific for people working at MGH though, or.
But there are a lot of non-clinical career tracks that doctors can take. Mm-hmm. If you're an MD who's done a residency, you are sought after by companies, biotech. People, they're desperate for people who understand clinical trials and the clinical side of a product development. You can only so many engineers and PhDs in a room before you can really develop something that is useful for patients. And you need somebody who knows the clinical side of things to really help develop a product.
Yeah, we have, I think, Monica, are you still on the call?
I'm here. Hi.
Hi, Dr. Dweck is an ophthalmologist at Sinai, who's also, I don't know if you knew her from when you were in med school or no?
No, I haven't been on the faculty that long.
Okay, so. She is the director of career services for the medical students. So, Monica, I don't know, did you have anything you want to ask in particular, or?
No, Dr. Cohen, I appreciate everything you've said, and I'm going to, like Alexis, use some of your statements because they're pearls. Okay.
Oh, thank you.
I appreciate that.
Oh, having me today.
Okay, great.
All right, I want to give the students one more chance. Anybody else want to ask any questions?
I have a question, actually. I'm Haley. I'm a first year. I just have like a broader question about anesthesiology. I know that you did a fellowship, but I'm wondering how much opportunity there is to kind of have more of a breadth and like assist on different types of procedures, or do most people wind up doing fellowships for more specific fields?
That's an amazing question. And I would say you do not need to do a fellowship. Already after you finish residency in anesthesiology, you're a consultant. You're not considered, you won't really recruit your own patients and you don't longitudinally follow your own patients. And so already you're a subspecialty, a surgical subspecialty. To do a fellowship only just specializes you more. And I probably should have expounded upon this more, but now since you bring it up, I will. So I did the fellowship and I sort of realized that the practice of cardiac anesthesiology is pretty rough. It's long hours, really sick patients, and the work is harder than any other type of anesthesia, in my very humble opinion. So I picked something with long hours that was really hard. It sort of left me with very little time for my family. And I really had some moments to think about that and think about what was really important to me in life. And so I took a step away from the field, even though I'm certified in transesophageal echo and I have my board certification in cardiac anesthesia. I decided to have a greater breadth of practice. So I work some days of the week on labor and delivery, taking care of parturients. I work in the main ORs, and that includes orthopedics, neurosurgery, vascular surgery, GYN, GU, burns, I mean, everything. The things I really don't do much of are pediatrics, which is fine. That's also another subspecialty within anesthesia that you could do. But I don't practice pain medicine or ICU either. Once again, those are sort of areas carved out for people who really want to like focus on those areas. With that said, if you join a community practice after your residency is over, you may be asked to do all of those roles. It depends on where you decide to practice. Choosing a large academic center like Mass General or Mount Sinai, you may be more what is considered siloed, and you might have an area of practice that then you do every day and you become very good at it, and you don't work as broadly. But there were jobs I applied for. I looked at a job at Dartmouth Hitchcock, and they wanted me to do ICU medicine in addition to cardiac and everything else because they thought I could, but I didn't have a fellowship in it. So it really all depends on the practice you choose afterwards. And I want to leave you with a great sense of confidence that you could do all of it after your residency is over. You don't have to do another fellowship.
Thank you.
Welcome.
Hi, I have a question.
Yeah.
My name is Lucas. I'm a first year interested in anesthesiology. You mentioned that you do kind of 75 instead of 100% of the week. How is that kind of navigated? Is that based on your specific job offering? Is that something you can negotiate with? Like, how did you get to that point?
Yeah, so great question. I knew before taking the job at Mass General that I had the opportunity to scale back or scale up. And it was sort of known to me from the interview process that that was an option. When I first started, I was 100% FTE, sort of like almost anybody, but I also showed up pregnant with my first baby. And I decided, I'll have my first kid and I will sort of just see how it goes. And after about 2 years, I decided, you know what, I do want to scale back and I'd really like to enjoy these really early years with my kids. And so what it took for my department was a 6-month notice. I said, I want to drop down. And I just set it up with them. I don't go into work any Wednesday or any Thursday. And I'm sort of off the grid. Nobody calls me for anything. And the interesting thing about anesthesia is because you don't have a panel of patients calling you for test results and new problems and issues, you're really kind of off the grid, so to speak. Nobody's going to ask me to do an intubation from my living room. I mean, it doesn't happen that way. So it is a really nice field to be able to kind of like come on and come off. And the flexibility is really, really great in that way.
Is that in your interview process, did you interview at other places and have a similar experience, or was this kind of flexibility unique to MGH?
I think MGH wins in all of Boston. I should just say in the anesthesia departments as being the most flexible. There are always trade-offs, right? So it's an academic center, so the reimbursement is never as high as it is in private practice. But like, what's important for you? And how much money do you need? I mean, you need enough to be able to pay your mortgage and buy your groceries and save for retirement. But beyond that, for me right now, the most important thing is just to be able to enjoy my family while they still want to spend time with me.
I have a question too.
Yeah.
Hi, I'm Gabriel. Hold on, let me turn my camera. Hi, I'm a second year. So I know you said you found anesthesia like one of the later rotations you did. So how was like the support from Sinai and the department when you decided to apply?
It was great. So once again, since you asked, I didn't want to feel too hasty in asking myself to like choose between pediatrics, which I thought for the last 3 years I was going to do, and anesthesia, which was the thing that I was most excited about. So I actually double applied. I sent off, I did like 2 separate ERAS applications. It was a lot of interviews, but I wanted to keep both options out there. And I found out through the interview process of meeting my future co-residents in pediatrics and meeting my future co-residents in anesthesia, and meeting all the staff along the way where I felt I fit in the best. And I honestly, I'm not really sure that anybody in the administration tried to dissuade me. I certainly wouldn't recommend this to other people. I think it was something that, I wanted to feel so sure about because it's such a big decision to make, how to pick a specialty. But going through a number of interviews really helped me solidify the decision for myself.
Did you wind up listing peds residencies on your rank list then, or you did?
Just, I mean,
Oh,
in
okay.
the office, like I didn't get any of things.
Yeah.
So with pediatrics, then be unmatched. So that's
right.
So it was a really exciting day for me, match day.
And so along the way, you didn't get, and so did the anesthesia people know that you're applying for peds and vice versa, or?
I think at the end of the day, I wound up telling the pediatrics department at Sinai that I was going to rank anesthesia above pediatrics because I didn't really want bad blood there. I wanted to feel really clean about it. And before they had to submit their rank list.
Okay, makes sense.
Yeah.
That is a lot of interviews.
It was like leading a double, triple life at times. To interview for pediatrics, then anesthesia, and then, a lot of them were still advanced programs. So you had to apply for internal medicine separately. It was.
And then did you have different letter writers or just the same one writing 2 different letters, or?
Different letter writers.
Okay.
But anyhow, I wouldn't recommend this, as I mentioned. I would your specialty and then apply in it because it's a lot of work anyway.
Any other questions?
I just have one more question. Sorry for asking too many questions.
No, you're not.
Okay. I mean, as a student, I'm also very interested and involved in the entrepreneurship, and I find your role, your newfound passion and innovation, and bringing a product into the market, very fascinating. I actually have a startup of my own as well, so that's where I'm coming from. And my question is, what are some of, like within the field of anesthesia, what are the biggest areas of innovation currently? Besides, I would assume like the area of drug development must be big for anesthesia, but what are some other areas of innovation for the field?
Well, I would say number one is the area of pain medicine, whereas there's like a massive need for something that works that's not an opioid. I mean, we're living through an opioid crisis, and it's still like one of the best oral medications we could take. I think that there's a huge amount of work to be done still in the area of pain medicine. And in terms of devices, I mean, there's always something that's better, less invasive, more ubiquitously available. I'd say Baxter, developed the Cheetah Monitor, which just is 4 electrodes on each quadrant of the torso. 1, 2, 3, 4 to make a box. And then it gives you parameters like stroke volume and SVR. I mean, all non-invasively. I mean, you don't need a TEE. You don't need a central line for them to be able to tell you that information. I don't know that it'll ever come to market, but there's certainly endotracheal tubes with nanoparticles on the inside that are able to, be close to the great vessels that are able to give, PA pressures and interesting things like that. We've got Boston Scientific that made the CardioMEMS, which is a small, tiny implantable device that gets through a right heart cath, gets put into the PA, and then gives patients their PA pressures. And as they see them rise, their cardiologist is able to tell them, oh, take another dose of Lasix, and it helps them stay out of the hospital with episodes of heart failure. I mean, there's so much stuff. There's an ever striving goal to be less invasive and more available. And especially for, listen, this is probably not the last pandemic we are going to see in our lifetime. Things that can be done remotely, information that can be gathered from home and sent to the office. I mean, these are all really important things that we don't have. Can't even take a set of vital signs at home without a blood pressure cuff and a pulse ox,
Yeah, the pain management one I think is a great point because, especially for orthopedic patients, the opioids are something we really want to try to avoid, but then there's not good alternatives either. So what's your startup?
Oh, me?
Yep.
So it's something that I started from college. We basically provide affordable paper devices that can detect counterfeit medicine.
Oh, cool.
That's what I've been working on.
Yeah, there's speaking, if you are interested in medication safety, I mean, there's a lot of stuff in patient safety in the world of anesthesia, specifically around the idea of medication safety, which is so critical because when you think about how a medication is delivered on a hospital floor, you have a nurse who takes it out of a system, scan the barcode, you have a second person verify it, and then you give it to the patient. In the OR, you draw it up and you give it, and there's no checks between the two. And there's some innovation that's happening, at least with softwares and labeling equipment that is trying to help with reduce medication errors, but is also like a huge area that needs to be worked on. Anyway, just to say, in your area that you've already identified that you're interested in.
Thank you.
Great point. James, you've been pretty quiet. Do you have any questions?
Yeah. Hi, I'm a first-year med student. Thanks so much for taking the time with us today. If you were to describe the feeling you have towards your career in 3 words, what would you say?
I would say creative, challenging, stimulating. I think there's an ever-striving quest to pick the perfect anesthetic for an individual. No two are ever the same. And you really have to work with your therapeutic alliance, with your patient to come up with the best strategy for them. And sometimes when the patients are really sick, it can be really hard. But I never leave a day at work thinking I was bored, ever, ever.
So I work with a lot of anesthesiologists just from being in the OR. And Kate, I would say you're definitely probably the most passionate anesthesiologist I've ever heard speak. It's great though.
That's awesome.
So I guess the students that are off camera, I'm assuming you guys are just listening in, but does anyone want to ask anything else?
I do have a question. This is Ruben. I'm between second and third year. I'm in a scholarly year. So I'm wondering for all of us that are still sort of like, I mean, I think in medical school, you're often thinking of like, what residency should I do? What program should I apply to? And you're constantly thinking about the future and not really sort of living in the present. So I'm just wondering if you have any advice in terms of like how to make the most of medical school, or something that you wish you would have done, something like that.
You know, it's really interesting. If you were to have looked at my CV, my resume from medical school, you would never guess in 1,000 years I would have wound up an anesthesiologist. I would just say, follow where your passion takes you, and you'll find success. There can't be anything else besides that. You have to do what's interesting to you. You have to work with the people that inspire you. You know, write something if it makes you excited. Don't write something. Take a trip. Work at a clinic. But listen, like, I spend like hundreds of hours every year working on a primary care clinic. And then I wound up as a perioperative physician. So, you know, it's just interesting how things come and go. But I would say my number one advice would be follow your passion, no matter whether you think it fits your story on paper or not, because you just never know where it's going to lead you.
Yeah, I would say you also don't have to be set the day one you arrive at med school, because I would say going from pediatrician to cardiac anesthesiologist is actually two very different stereotypes, I guess, you know. So I think there's definitely a lot of pressure as a first year to say like, okay, well, I'm going to do this residency, so I got to start doing research and whatever. But I think you've shown that you really can decide later on, and kind of don't be afraid to either, because, you know, it'll still be fine.
Yeah, there's a lot to be said for academic boldness. Just try something you're interested in and see how it goes. It'll make you a more person and a more well-rounded person overall.
Yeah, I think having all those, like the interest in peds and then doing the internal medicine clinic and all that really probably makes you a better anesthesiologist. So
I hope so.
Lucas, I'm getting mesmerized by the fish tank behind you.
Hi, Dr. Cohen. I'm Justin. I'm a first-year student as well. And I was wondering, for students interested in the innovation space, do you have any advice on how to get involved as a medical student?
Oh, it's such a great question. If I knew, I should have done it when I was a med student. I have to tell you, I'm just starting to get into it myself. I found this fellowship that's was available through Mass General Brigham. There may be other fellowships of the type out there. I have to tell you, I don't really know where they are though. But if you do happen to train up here in Boston, this would be a fellowship available to you as soon as you finished residency. I would say, don't be afraid to just reach out to people. You know, I don't know if you have what kind of time commitment you have as a student to be able to take on projects, but you know, you can go on to websites and you can start to email around. I would say that a lot comes with the pedigree of being a Mount Sinai student. And if people see that you're interested, you may be able to get involved in projects on a part-time basis. That would also probably fit your schedule as a medical student.
Justin, you have a startup also, right? Or
No, I'm currently working as a program facilitator for the National Institutes of Health Rapid Acceleration of Diagnostics initiative. So basically, I'm helping to evaluate like COVID-19 diagnostic proposals, and I've been doing that part-time all while, like through first semester. And so
that's right. Okay.
I have like a little bit of training, but I definitely would want more and have it be more focused on like medical devices and like medical devices that get implanted into the body and like robotic surgery and stuff like that.
Yeah, all interesting areas. I don't know, maybe Alexis can connect us afterwards and I'll try to help you find some resources. Whatever I find, I'll send to you.
I think there's like a Sinai Innovations Center, Justin, but I'm not sure what the resource. I don't know that much about it though. Have you heard of it, or has anyone heard of it?
I have. In fact, I went to a 2-day conference that they held last year, which was wonderful. I'm also on the board of the Diversity Innovation Hub, and several of our participants in the hub have innovations and in various specialties. As part of the Sinai Innovation Group, there are different offshoots that you can explore. You may want to reach out to Dr. Mary Rojas, who can give you some contact information for that. but they do a lot, and a lot of research is coming out of it in different specialties.
Oh, that would be great. Thank you so much. I'm actually one of the TAs for the Diversity Innovation Hub's pipeline program.
Okay.
I'll definitely reach out.
A great start. Good.
Justin, like something maybe like there might be a need for an innovation group among the Sinai students.
Yeah.
Just thinking. Sounds like a bunch of you have the same interests.
I know. I don't know how they do that plus do medical school at the same time. I definitely could not do both. So,
right.
Anybody want to ask any other questions? Oh, let's see. Sinai Biodesign team. Great, thank you. All right, so I guess if anyone has any other questions for Dr. Cohen, you can always email myself or Jason and we can connect you directly with her. Thank you so much for taking the time out of your super busy schedule.
You're so welcome.
It's really appreciated.
Yeah.
Right.
And in touch with any other questions.
Okay, thank you.
Thanks.
Thank you.
Bye.
Thank you.
Here, guys.
Yeah.